धन्यवाद प्रीति। एक्चुअली आज ब्रेस्ट कैंसर को मैं आयुर्वेदिक पर्सपेक्टिव से बताने के लिए आपके साथ हूँ, आपके बीच में हूँ। भले दूर हूँ लेकिन आप लोगों के बीच में हूँ। आयुर्वेद इज नॉट जस्ट चूरन काढ़ा पूड़ी, वो चिकित्सा एक पार्ट है आयुर्वेद का, है ना। कि जन्म से लेके जन्म के पहले से लेके 9 महीने हम जो गर्भ संस्कार करते हैं, वहां से लेके आखिरी क्षण तक हम जो लाइफस्टाइल जीते हैं, हम जो रिचुअल्स फॉलो करते हैं, वो आयुर्वेद है। तो करकारबूत, स्तन्य का करकारबूत, ये एक नाम है जिसको हम ब्रेस्ट कैंसर बोलते हैं। ये हमारे साइंस में असाध्य बिल्कुल भी नहीं है, कष्ट साध्य बोल सकते हैं। पहले 1-2 स्टेजेस में ये सुख साध्य भी होता है, 3rd-4th स्टेज में आते आते ये थोड़ा सा कष्ट साध्य होता है, लेकिन असाध्य बिल्कुल भी नहीं है। और ब्रेस्ट कैंसर ये सिर्फ फिजियोलॉजिकल प्रॉब्लम नहीं है, ये फिजियोलॉजिकल, इसको हम साइकोसोमेटिक बोल सकते हैं। कहीं ना कहीं पहले मन में गांठ होती है, कुछ तो लॉकिंग्स रहते हैं, कुछ फियर फैक्टर रहता है, कुछ सुनी सुनाई बातें रहती है कि अगर मेरी माँ को कैंसर हो गया तो मुझे होगा ही होगा। या सतत हम अगर इस फियर में रहेंगे कि शायद मुझे भी कैंसर हो सकता है, तो हम उसको मैनिफेस्ट करते हैं। आजकल हम बोलते हैं कि एक सर्टेन एज के बाद में स्तन की चिकित्सा करनी चाहिए, जांच करनी चाहिए, मेमोग्राफी करनी चाहिए, वो सब करे, लेकिन उसके पहले हम निडर होके ये बात चीजें करें, डर डर के जांचे ना करें कि मुझे कहीं हो ना जाए, मुझे कहीं हुआ तो नहीं है ना। नोडुल्स, हर फिजियोलॉजिकल नोडुल्स तो हर एक के ब्रेस्ट में मिल जाते हैं आपको अप टू मेंसेस के 7 दिन 8वें दिन आपको वो बिल्कुल क्लियर मिल सकता है अगर फिजियोलॉजिकल होते हैं। उसके बाद में फिर 14वें दिन से वो चालू हो जाते हैं थोड़े थोड़े नोडुल्स बन जाना, लेकिन वो हर एक नोडुल कैंसरस नहीं होता है। ये आप लोगों को भरोसा करना पड़ेगा, और मुझे कुछ नहीं होने वाला है, मैं निरोगी रहूं, मैं आरोग्यवान रहूं, ये हम रोज भगवान के सामने हाथ जोड़ते हैं ना। तो भगवान के ऊपर अगर हमारा विश्वास है तो मुझे कुछ नहीं होगा, अगर कुछ हो भी गया तो भगवान मुझे उससे निकाल लेगा। आप देख लीजिए, हम सोचते हैं कि एयर पोल्यूशन है, वाटर पोल्यूशन है, फूड पोल्यूशन है, और ये सब के कारण या केमिकल्स के कारण, फर्टिलाइजर्स के कारण हमको कैंसर होता है, ऐसे हम बार बार सुनते भी हैं। लेकिन आप ये बात भी सोचिए ना कि एक घर के 4 लोग वही फूड खाते हैं, वही पानी पीते हैं, वही सरकमस्टांसेस में रहते हैं, लेकिन एक इंसान को कैंसर होता है, बाकी तीनों को नहीं होता है। तो इसके पीछे कुछ तो राज होगा, कुछ तो कारण होगा कि सिर्फ एक को ही हो रहा है। इसके पीछे अकॉर्डिंग टू आयुर्वेद एक प्रकृति एनालिसिस होता है। प्रकृति जो बोलते हैं हम, वातज पित्तज कफज द्वंद्वज, जो हम माँ की वूम से लेके आते हैं कि हमारी तासीर गर्म है, ठंडी है, वात प्रकृति की है, और उसमें हम वो जो फूड कॉमन में खा रहे हैं वो हमको सूट भी हो रहा है, नहीं भी हो रहा है, या वो एनवायरमेंट हमारे मन मस्तिष्क के लिए सही है क्या नहीं है, हम कितना प्राणायाम कर रहे हैं, हम कितने नेगेटिव एनर्जी बाहर निकाल रहे हैं, हमारी ब्रेथ कितनी शॉर्ट है, लॉन्ग है। ये बहुत सारे रीजंस होते हैं कि हमको ब्रेस्ट कैंसर हो या नहीं हो, दोनों चीजें होती है। तो मुझे बार बार ऐसे लगता है कि भले ही आप लोग बोले कि वो जेनेटिकल है या केमिकल्स के कारण है, होता है कि जो हम केमिकल्स यूज कर रहे हैं, जो शैम्पूज यूज कर रहे हैं, जो टूथपेस्ट यूज कर रहे हैं, नो डाउट उसमें कैंसर कॉजिंग एजेंट बहुत सारे हैं कि हम दिन की शुरुआत ही मुंह में कैंसर के एजेंट डालने से करते हैं। तो कहीं कहीं हमको लाइफस्टाइल बदलनी पड़ेगी, कहीं कहीं पे हमको हमारे भाग पे भरोसा करना पड़ेगा, कहीं कहीं पे हमारे प्लैनेट्स पे भरोसा करना पड़ेगा, क्योंकि ग्रह चिकित्सा ये आयुर्वेद का एक बहुत बड़ा रोल होता है, जिसका फिजिक्स और जिसका मैथमेटिक्स, और मैं जानती हूँ कि ये सीए वाले लोग हैं, इनका मैथमेटिक्स बहुत अच्छा होता है। तो जिनका फिजिक्स और मैथमेटिक्स अच्छा है उसकी एस्ट्रोलॉजी बहुत अच्छी होती है, कि प्लैनेट्स के साथ हमारी फ्रीक्वेंसी है, वेवलेंस है, हम कहाँ पे जन्म लिए हैं, तो वो सारी चीजें हमारे ऑर्गन्स पे क्या असर डाल रहे हैं ये हम समझ सकते हैं। और दूसरा कि जहाँ पे हम आयुर्वेदिक वे में फिर से बार बार आयुर्वेद का नाम ले रही हूँ, तो गर्भ संस्कार करके एक फैक्टर होता है आयुर्वेद में। गर्भ संस्कार मतलब सिर्फ ये नहीं कि हम भगवान को हाथ जोड़ने के लिए सिखा रहे हैं, या ऐसा नहीं कि हम सिर्फ मंत्र बोलने के लिए सिखा रहे हैं या श्लोक बोलने के लिए सिखा रहे हैं, दैट इज नॉट जस्ट गर्भ संस्कार। लेकिन हर महीने में जो जो ऑर्गन तैयार हो रहा है, उस ऑर्गन को उस महीने में हम जो नरिशमेंट दे रहे हैं। अब जैसे जिस महीने में स्तन तैयार हो गए, उस महीने में स्तन से रिलेटेड जैसे शतावरी हम देते हैं या का विदारी कंद आदि देते हैं, ऐसे कुछ कुछ मेडिसिन हम उस महीने में माँ को देते हैं। तो वो बच्चे के परवरिश के लिए, बच्चे के न्यूट्रिशन के लिए वो बहुत काम आते हैं, और बच्चे को बाद में वैक्सीनेशन वगैरह पर्टिकुलर डिसीज के लिए देने की जरूरत नहीं पड़ती है। सो दैट इज गर्भ संस्कार। गर्भ संस्कार ये नहीं कि कोई आए तो ऐसे झूठ मूठ जय श्री राम बुलाए, ये नहीं, नहीं ना। गर्भ संस्कार इज अ बेसिकल डिजाइनर वैदिक कॉन्सेप्ट कि आपके बच्चे का हर ऑर्गन सही रहे, स्वस्थ रहे और दीर्घायु रहे। प्लस शरीर, मन, मस्तिष्क मतलब बुद्धि और आत्मा, ये चारों को मिलके जो ट्रीटमेंट होती है दैट इज आयुर्वेदिक ट्रीटमेंट। सिर्फ फिजियोलॉजिकल ट्रीटमेंट से हो सकता है कि रिकरेंस बार बार हो जाए आपको। मॉडर्न थेरेपी में यूं बोलते हैं कि एक बार आपका कीमो रेडियो भी हो जाए तो 5 साल तक फिर से रिकरेंस होने के चांसेस होते हैं। लेकिन अगर आपका मन, मस्तिष्क या इमोशनल इंटेलेक्ट अगर अच्छा रहता है तो आप बिल्कुल, एक बार हो भी गया बाय चांस आपको कर करो, तो बाद में हम उसको हमेशा के लिए टाटा बाय बाय बोल सकते हैं। हमारा एक लाइफस्टाइल अच्छा रखने से, रीजनल, सीजनल और अकॉर्डिंग टू प्रकृति, हमारी खुद की प्रकृति के अकॉर्डिंग जो हम खाना खाते हैं या लाइफस्टाइल रखते हैं, या इवन पानी भी पीने का जो एक तरीका होता है, ऐसा नहीं कि सबके लिए 2 लीटर पानी, सबके लिए 3 लीटर पानी, सब लोग उठते बराबर 2 ग्लास पानी। दिस इज नॉट द मेथड अकॉर्डिंग टू आयुर्वेद। क्योंकि आप लोग समझते इतना है कि उठते बराबर पानी पीना है, लेकिन उठना कब है ये भूल जाते हैं कि अगर हम 8 बजे सुबह उठ रहे हैं और 2 ग्लास पानी पी रहे हैं तो नो डाउट हम डायबिटीज को, कैंसर को, थायराइड को इनवाइट कर रहे हैं। तो बेसिकली कैंसर आपके कफ जमा होने से, मन मतलब जो उरस स्थान है अपना, मन का स्थान होता है, मन को दुख लगता है, मन को चोट पहुंचती है, वो चोट आप दबा के रखते हैं बार बार, या और मैं फिजिकल लेवल पे, फिजियोलॉजिकल लेवल पे जाके बोलूं, शायद जो लोग एडवर्टाइजमेंट वाले हो गए कि मेंस्ट्रुएशन साइकिल में जो लड़कियों को बोला जाता है कि सब कुछ करो, खेलो कूदो, सब कुछ करो, दिस इज नॉर्मल। लेकिन ये नॉर्मल है, लेकिन इसके साथ जैसे अगर हम जस्ट सूसू पोटी भी करते हैं तो घूमते फिरते नहीं करते हैं, उसके लिए भी हम कुछ एक जगह पे बैठते हैं, शरीर को रेस्ट देते हैं, और उस समय एक्सक्रीशन होता है। बहुत बहुत क्या बोल, कॉमन भाषा में मैं बात कर रही हूँ। तो इसी तरह एटलीस्ट 48 आवर्स ऑफ मेंस्ट्रुएशन आपको शरीर को रेस्ट देनी पड़ेगी। हो सकता है कि बीच के 2 जनरेशन में उसको कुछ अलग दर्शन दिया या उसका कुछ अलग रूप दिखाया, लेकिन जहां पे आर्तव सिस्टम, आर्तव स्त्रोत, दैट इज आपके हार्मोन्स है ना, तो वो अगर ठीक रहते हैं तो ही आपका स्तन ठीक रहेंगे। आपके हार्मोन्स अगर ठीक रहेंगे तो ही ब्रेस्ट कैंसर होने के चांसेस कम रहेंगे। पीसीओडी होने वालों को ब्रेस्ट कैंसर होने की संभावनाएं बहुत ज्यादा होती है, या जिनको बहुत जल्दी मेनार्क आता है, उनके हार्मोन्स तो जल्दी बढ़ रहे हैं, उनकी शादी लेट हो रही है, उनके बच्चे लेट हो रहे हैं, तो वो जो एक एस्ट्रोजन का प्रेशर होता है, तो उसके कारण भी ब्रेस्ट कैंसर बहुत जल्दी बढ़ सकते हैं, नंबर ऑफ ब्रेस्ट कैंसर बढ़ जाएंगे। तो ऐसे वेरियस पॉइंट है अकॉर्डिंग टू आयुर्वेद। क्या क्या यहाँ पे डिस्कस करें, समय का लिमिटेशन है, समय सीमा है, तो बाकी हम क्वेश्चंस में लेंगे। तो कुछ एस्ट्रोलॉजी है, कुछ फिजियोलॉजी है, कुछ मनोवैज्ञानिकता है, ये सारों को मिलके ही ब्रेस्ट कैंसर होगा, अननेसेसरी नहीं होगा। तो सब नीडर बन के अपनी जांच करवाते रहिए कि मुझे नहीं हुआ है, लेकिन जैसे हम ब्रश करते हैं, रोज रोज नहाते हैं, वैसे मेंसेस के 8वें दिन एक खुद की अपने हाथ से जांच करें कि वो एक हमारा रिचुअल है यूं समझ के। अदरवाइज डर के करेंगे तो वो मैनिफेस्ट होगा। इतना कह के मैं मेरे शब्दों को विराम देती हूँ। टुवर्ड्स प्रीति।
थैंक यू डॉक्टर प्रीति। मेरे मन में तो बहुत सवाल हैं और मुझे पता है कि ऑडियंस के भी बहुत सवाल हैं, लेकिन पहले मैं चाहूंगी कि मैं पुरिया से कहूं कि हमें संबोधित करें। पुरिया, ओवर टू यू एंड इन इंग्लिश।
Okay. So am I audible? Yeah. So thank you so much, Dr. Preeti. She has given me so much to think about. So, the first question, or, one of the few questions that I was always asked, do you really know why you were diagnosed with cancer? So maybe I don't really know the reason as of now, but I think she's given me food of thought hai bahut. I can actually now go home and maybe just think about a few things and actually think about, what can be the reasons. And keeping that aside, so I'm obviously not an expert. So I've just been through the entire journey, and yeah, it was challenging. And I also have my parents with me today, and they have been extremely instrumental, and they have been really helpful. And I don't think I would have been able to come out of it if they wouldn't have been there. So they have been with me right from the start, and I'm really very thankful to them. And I'm so happy, they could join today. So I don't really know what should I exactly talk about. And since we're taking up questions as well, so
a little bit about, what age did you get diagnosed,
okay.
and how was your treatment? And
So I was diagnosed in 2018, and I had just turned 30. So it was kind of a rude shock, as a birthday gift. So, but I think, as Dr. Preeti also mentioned, ki man mein gaat, kind of, but I had a gut feeling, I had an intuition that something is wrong. And as she mentioned, during self breast examination, I found a lump in my breast. And one, extremely important thing is, sometimes even in a society, saying the word breast out loud is sometimes also, little, thoda, people find it a little odd कि ये क्यों है, क्या है. So I'm actually very also thankful to BCAS to even first of all, arrange for such an amazing talk where we are creating awareness, sharing our experiences, and also talking about it so openly. And the most important thing is, I'm seeing so many gentlemen here who have come and they are here to, listen to a conversation like breast cancer. And I'm sure, they'll go home and, share whatever their learnings are or whatever their experience, whatever they've heard here. They'll go home and, share with, say, their sisters, their spouses. And I'm really happy, that this is actually happening. So coming back to, I was diagnosed in 2018. I was 30. And I found a lump. So the first thing is I went to the gynac. So again, there's a point around this. Some people don't even have gynacs. So, which is a little weird, I think. But, it's actually very important to, be aware of your body, especially as women. You should actually go to a gynac. So even coming back to that, so when I got my menstruation, even before that, I remember my mother had taken me to an Ayurvedic doctor. She sat me down and she explained what menstruation cycle is. So even how should you go about self-examination, kya hota hai? How should you do it? When should you do it? So I think that was very important at that point. I was in school, but still I was given that knowledge at that time. So when I went to the gynac, so she felt something is wrong, but even I, since I had this instinct, I had this gut feeling. So the day I went there, I just knew that something is wrong. And so after that, she recommended, she called for some tests. So usme, then there was a sonography, there was mammography, and the reports came back. And so I was also recommended to go for a biopsy. So when the word biopsy came up, I just knew that something is wrong, and we just have to get it done. So also funny enough, I also remember I had gone to the gynac. So she told me you have to get all these tests done. And in the frenzy, or in the moment when I knew something is wrong, I also remember I had called my mom. She has that the gynac has told me to get all these tests done, and she was, unfortunately, my mother was not well. So she told me, I'll arrange for you just go and get the test done. So I remember I had gone all alone. I went and got the test done. So that was an experience, because I had never done that before. But I don't know, something when you have this kind of a survival mode feeling, you have to get it done. So something in me just told me I have to go and I have to do it. And I went for the tests, and after that the reports came back. And immediately, I think in the next 1 or 2 days, we also went for the biopsy. And so I think after around 2 weeks or so, we got the tests back. And I also remember, my parents, so when we got the report, so basically my mom got the call first, both my parents. So they were the first ones to come to know about my diagnosis. So I don't really even know, what they must have gone through and it's not easy to know that your daughter is, has it. You'll never think of the worst. You'll always be hopeful. You would not want that to happen. But they were the first ones to come to know. And and funny enough, I kept on asking them. I kept on asking my mother, why have the reports not come back? And I had a feeling, now that, it's taking so much time, why have the reports not come back? But anyway, so then I was in Dombivli at that time. So they actually came all the way from Thane. They came, they got the reports, and they came home, and they sat me down and they told me that, this is the report and this is the diagnosis. And my response in my head was, I know. That was my reaction. I don't remember crying. And in fact, I remember my mother-in-law, my father-in-law, my father, they cried in front of me. And, I felt so bad that, they have to go through this because of me. But in my head, my first reaction was, I know. And, that is where your gut feeling, or knowing from within, or when to listen to your body, understanding your body, I think is very important. And so we came to know about the diagnosis. Then after that, then the series of tests, then uske baad. So basically, then the first thing is going to an oncosurgeon, an oncologist. So an oncosurgeon first. So we went to Dr. Anil Herur. So, and the first thing is very beautiful. I'll never forget that. We sat in front of him. Entire family had gone. So we were, a little apologetic कि sorry, all of us have come. So he's like, the more the better. अगर और भी कोई बैठा है बाहर तो please देके आओ. So I mean, that's so beautiful for a doctor to say that, because again, the awareness part comes from here. So it's just not the patient who is going through the treatment, it's the entire family. And especially with a disease like cancer, the treatment is going to be long. So the entire family is going to suffer with the patient. So it's better for the entire family to know what is going to happen, or just to have an idea कि क्या हो सकता है. So then he sat us down, he explained the entire thing. And the first thing he told me after that is, you have been diagnosed with breast cancer. It's one of the most common cancers. And I think you are lucky that you're in this day and age where treatment का भी अभी nowadays possibilities है, ज़्यादा है. So even the possibility of survival or even getting out of it is even much more. So उसके बाद then धीरे धीरे then the first thing is then series of tests. So उसमें PET scan होता है. So I remember, do I have time? Yeah. So PET scan में there was an hour when they had injected a fluid in me. So then basically they make you sit in isolation for an hour. So that is exactly when the entire feeling sunk in, because I was all alone. Till then it felt as if movie chalu hai. I'm the main character in the movie. I'm the actress, and sab chalu hai. Everyone is talking about somebody, somebody who has been diagnosed with cancer. But in that 1 hour, it actually dawned upon me कि okay, people are talking about me and मुझे हुआ है. And that's when I cried for the first time. I remember very distinctly crying. I did not know. I felt lost because there was nobody around me. And that's when I realized that this is going to be a challenge. And if I'm not strong from here, from this day, then, it will be a little difficult. I'll have to face it. Physically, I know I'll be taken care of. There are doctors who will take care of me, surgery ho jayegi and whatever. But mentally, I have to be extremely strong. And also, I have also, so many loved ones around me. I have to also be a little strong for them, because ultimately, kya hota hai, once you go through the entire treatment, you as a patient, कि क्या हो रहा है body में, but people around you will not know. And sometimes it's also very difficult for us as patients to even convey कि क्या हो रहा है, because even you are not aware कि क्या हो रहा है, especially when it comes to chemotherapy, because the side effects literally change every day or every hour. So even for us to process कि क्या हो रहा है, it becomes difficult. So then I think I'm taking a lot of time. No. So I think. Okay. So just in short, so basically, so PET scan में, so PET scan basically is to figure out has the cancer spread anywhere else. So in my case, the cancer had spread from the breast to the armpit as well. So uske hisab se then they decide what's the next course of action. So do you go for surgery first? Do you go for chemotherapy first, or anything else? The course of action basically. So then in my case, one surgery was first decided, and then chemotherapy, and then radiation. So along with the surgery, I was also advised to go for a reconstruction surgery. So I also got my breast reconstructed. So both surgeries happened on the same day. So I think it took around 6 to 7 hours, if I'm not mistaken. I don't know. I was asleep, so I don't know. But anyway, so 6 to 7 hours में दोनों surgeries हो गए. And then later on, rehabilitation, then getting a little better from the surgery. And then uske baad, I had around 8 to 9 rounds of chemotherapy. And then uske baad, I had a few rounds of radiation. So, now it's actually very funny, I'm just saying it out loud, as if it's just ऐसा हुआ है, but everything happened in a span of around 8 to 9 months. So May to December. So December 2018, my treatments got over. So I think 6-7 months or more, 8, yeah. So this is basically, I think, short में बोलना चाह रही थी, but I think ज़्यादा हो गया. So I think.
डॉक्टर प्रीति, तो जस्ट अभी इसको आगे लेने के लिए कि आपने बोला था कि देर इज अ रिलेशन ऑफ जो आपने एस्ट्रोलॉजी का एक बोला था इफेक्ट्स, एंड उसके सिवाय आपने बोला था कि फूड हैबिट्स, ऋतु और उससे ये होता है. तो एज अ आयुर्वेदा प्रैक्टिशनर या आयुर्वेदा से आप क्या बता सकते हैं कि एवरी पर्सन विल नॉट बी एबल टू गो टू एस्ट्रोलॉजर, और शायद जाते नहीं रहेंगे, पर ऐसे क्या ट्रेट्स है हमारे में, या जैसे आपने बोला कि बॉडी से आपको पता चलता है, तो सिमिलरली आपकी हैबिट्स से या आपकी बॉडी क्या इंडिकेशंस देती है देयर इज सम इम्बैलेंस विच इज रिलेटेड, जो आपके ग्रहों से रिलेटेड हो? स्पेसिफिकली आपने अगर मून का बोला तो एटलीस्ट व्हाट वी हैव लर्नड इन साइंस स्कूल में कि हाई टाइड्स लो टाइड्स पानी के ऊपर मून का बहुत प्रभाव पड़ता है, तो क्या उसका रिलेशन ये डिजीज के साथ भी हो सकता है? एंड दूसरी चीज कि ऋतु के हिसाब से आपने जो खाने की या खाने के समय की या पानी का जो बोला है, तो उसमें क्या केयर ले सकते हैं उसके ऊपर अगर आप थोड़ा डेलिब्रेट कर सकते हैं तो।
सबसे पहले मैं प्रकृति एनालिसिस के ऊपर जाऊंगी कि हमारी प्रकृति क्या है, ये हम सबको पता होना चाहिए। या स्कूलिंग से भी हमको वात पित्त कफ, आजकल मुझे लगता है 4th या 5th से ये चालू हो गया है, पंच महाभूत त्रिदोषी पढ़ा रहे शायद, कि त्रिदोष पंच महाभूत से ही बनते हैं, जो जो ब्रह्मांड में है वो अपने शरीर के अंदर है। तो हमको उस हिसाब से खाना पीना चाहिए। हवा पानी और अन्न, ये 3 हमारी बेसिक नीड्स है। और हवा मतलब ऐसा नहीं कि हम सिर्फ हवा में खड़े हैं, टू ब्रीथ करेक्टली वो ज्यादा जरूरी है। हम प्रॉपर हवा ले रहे हैं तो हम समय पे जाग रहे हैं, समय पे सो रहे हैं, वो भी हवा के इनटेक का एक प्रकार है। क्योंकि अगर हम सनसेट के बाद में अगर ज्यादा एक्टिव हो रहे हैं, ज्यादा मूवमेंट्स कर रहे हैं, तो नो डाउट हमारे इनहेलेशन बढ़ता है और रात में हम कार्बन डाइऑक्साइड ज्यादा इनहेल कर रहे हैं। और जितना अर्ली हम उठ नहीं पा रहे या दिन में अगर हम सो रहे हैं, सूर्योदय के बाद में हम जितने घंटे सो रहे हैं उतने घंटे हम ऑक्सीजन को मिस कर रहे हैं। कोरोना में सब लोगों ने देखा कि ऑक्सीजन सिलेंडर्स बहुत महंगे थे, नहीं मिल पा रहे थे। लेकिन जो हमको फ्री में मिल रहा है कि ब्रह्म मुहूर्त पे हम उठते हैं, वहां से जो वात अपने को मिलता है, वात यानी वायु, प्राण वायु, कि ओजोन हमको ज्यादा मिल रहा है, ऑक्सीजन हमको ज्यादा मिल रहा है, तो वो अगर हम मिस कर रहे हैं तो वो एक बड़ा प्रॉब्लम होता है। मैंने इवन पानी के बारे में भी बोला कि जो सूर्योदय के बाद में लेट उठ के पानी ज्यादा पीते हैं, तो वहां पे कफ का संचय होता है, हवा का। आप देखते हो कभी सिंक अगर ब्लॉक हो जाता है किसी का, तो उसको वैक्यूम से क्लियर किया जाता है। उसी तरह अगर हमारे शरीर में जो हमारा चेस्ट एरिया है, वहां पे कफ डोमिनेंस थोड़ा ज्यादा होता है, तो वहां पे अगर हम डीप ब्रीदिंग करते हैं, ये डीप ब्रीदिंग का भी एक अनुभव होना चाहिए, प्रशिक्षण सबको होना चाहिए बचपन से कि हाउ टू टेक ब्रीथ। तो कितने लीटर हमको हवा चाहिए, हमारी प्रकृति क्या है, हमको सबको वॉक करना है, सबको जिम जाना है, एक्सरसाइज करना है, मतलब एग्जैक्ट मेरी प्रकृति के लिए मुझे क्या करना है। 24/7 जिम आयुर्वेद में नहीं बताई गई है। हम लोग आजकल देखते हैं कि लोग सो कॉल्ड एक्सरसाइज के लिए 24/7 जिम जाते हैं, 12 महीने एक जैसे एक्सरसाइज कर रहे हैं, या किसी भी ऋतु में उतना ही आपको 1 घंटा एक्सरसाइज करना है, मतलब करना है, ये उनका फिक्स होता है। उनको अगर ग्रीन टी पीनी है, उसको वो अच्छा मानते हैं, तो अच्छा मान रहे वो किसी भी सीजन में, किसी भी रीजन में, किसी भी प्रकृति में वो ग्रीन टी पी रहे हैं। या अगर शुगर नहीं खाना है, फैट्स नहीं खाने हैं, ये सबके लिए नहीं है कि किसी के लिए घी बहुत खाना जरूरी है, कि जो पल्प्स बनते हैं या जो लम्स बन रहे हैं हमारे ब्रेस्ट में, उसको क्लीन करने के लिए, उनको निकालने के लिए। आप देखते हैं इवन बालों में भी कभी उलझन हो जाती है ना, गठान आ जाती है, तो हम थोड़ा सा ऑयलिंग करके वो गठानों को निकालते हैं। तो विदाउट फैट हम सोच ही नहीं सकते बीइंग आयुर्वेदिक। इवन मीठे पदार्थ नहीं खाने चाहिए, ऐसा एक चलन चल रहा है, मीठा नहीं खाना चाहिए। लेकिन फैक्ट्री मेड मीठा नहीं खाना चाहिए, वो मैं मानती हूँ। लेकिन जो नेचुरल, जैसे मिश्री है, खांडसारी है, गुड़ है, ये चीजें हमारी ब्रेन के लिए जरूरी होती है, हमारी ग्रोथ के लिए जरूरी होती है। और आप ये भी समाज में देखते होगे ना कि जो बहुत वेट के ऊपर काम कर रहा है, जैसे सिने सृष्टि में हम देख रहे हैं, बॉलीवुड में देख रहे हैं, तो वो भी कैंसर से कहाँ बच रहे। वो भी तो सो कॉल्ड अच्छा खाना ही खाते हैं, सो कॉल्ड बहुत हेल्दी फूड ही खा रहे हैं, अच्छी जगह पे रह रहे हैं, पोल्यूशन नहीं है। तो वहां पे गौरव जी एस्ट्रोलॉजिकल पार्ट आता है कि किसका चंद्रमा अच्छा है, किसका शुक्र अच्छा है, किसका गुरु नीच का है। गुरु नीच का है मतलब मेटाबॉलिज्म रेट आपका स्लो डाउन होता है। या मंगल या शनि, अगर हम देखते हैं शनि को भी यही इसी में देखेंगे कि मेटाबॉलिज्म रेट बहुत कम है, इसके कारण लम्प्स होने के चांसेस बढ़ जाते हैं, क्योंकि फायर एलिमेंट आपका चैनलाइज नहीं रहता है। जैसे मंगल और सूर्य, इनको हम फायर एलिमेंट समझते हैं, तो उनको चैनलाइज रखना बहुत जरूरी है। ऐसा नहीं है कि आज कैंसर सिर्फ वुमेन्स में होता है, सिर्फ महिलाओं में होता है। कैंसर, ब्रेस्ट कैंसर आजकल पुरुषों में भी होता है, और वो इसलिए थोड़ा सा असाध्य में हम मानते हैं, क्योंकि स्तन ये मर्म स्थान माने गए हैं कि उनको हम सीधा जाके छेदन नहीं कर सकते डायरेक्ट। ऐसा नहीं है कि आपको ब्रेस्ट कैंसर हो गया तो हर कोई एंकोलॉजिस्ट उसकी सर्जरी करेगा। आचार्य सुश्रुत ने भी कहीं कहीं जगह पे ही सर्जरी बताई गई है, अदरवाइज उनको बहुत संभाल के ट्रीट करने के लिए बताया गया है। आचार्य सुश्रुत ने जो अर्बुद के ऊपर ट्रीटमेंट दी है वो आज भी चलती आ रही है, कि जैसे हीरक भस्म है ना गौरव जी, आप शायद कोरिलेट कर रहे होंगे कि ये शुक्र के ऊपर बहुत काम करता है, डायमंड, है ना। कीमोथेरेपी में जो हम मुक्ता पिष्टि देते हैं या मूंगे का भस्म देते हैं, तो वो आपके शरीर का टेम्परेचर मेंटेनेंस के लिए, चैनलाइज करने के लिए हम उसको देते हैं। और जो कीमो में, ड्यूरिंग कीमो जो जो प्रॉब्लम्स होते हैं, जो साइड इफेक्ट्स होते हैं, उसको हम अभी जैसे मैंने बताया ना कि मुक्ता पिष्टि है, जैसे पर्ल का पिष्टि होती है या कोरल की पिष्टि होती है, तो वो आपका मन शांत रखने में हेल्प करता है। क्योंकि ड्यूरिंग कीमो जो जो लोग गुजर जाते हैं, उनकी जो मनस्थिति होती है उसको कूल डाउन रखना वो बहुत जरूरी होता है। पुरिया जी, आपके नाम से जो राग है, हम उस राग से काफी पेशेंट को ठीक करवा रहे हैं, जो फर्स्ट स्टेज पे है, कि जो बांसुरी बजा सकते हैं। क्योंकि यूजुअली ब्रेस्ट कैंसर में विशुद्ध चक्र, अनाहत चक्र और स्वाधिष्ठान चक्र, ये 3 चक्र डिस्टर्ब होते हैं। और जो अनाहत चक्र होता है, जो चेस्ट वाला पार्ट होता है, तो उसको खाली करना, मतलब वहां पे जो ट्रैफिक जाम हो चुका है उसको निकालना बहुत जरूरी है। तो उसके लिए बांसुरी बजाना, बांसुरी सुनना, और खास करके कुछ कुछ राग, जैसे राग पुरिया है, राग भैरवी है, राग बिहाग है, जय जयवंती है, बागेश्वरी है, ये बहुत अच्छे से काम करते हैं। या मंत्र, कौन सा मंत्र किस समय पे बोलना है, वो भी अकॉर्डिंग टू प्रकृति बहुत अच्छे से काम करता है। कि गायत्री मंत्र हम अगर भरे दोपहर में 11 बजे 12 बजे बोल रहे हैं तो वो आपको काम नहीं करेगा। या अगर हम महामृत्युंजय मंत्र का जाप करवा रहे हैं कि कोई कैंसर हो गया है और इसके सर्वाइव, एक तो हर कैंसर आपकी लाइफ का एंड नहीं करता है। सबसे पहले कि जिसको जाना है, जिसको बुलावा आया है वही जाएगा, हर कोई नहीं जाता है ना। तो वो मंत्रों का भी एक समय होता है, मंत्र बोलने का भी एक तरीका होता है। आयुर्वेद सिर्फ ऐसा नहीं ना कि आपने काढ़ा पिया, पूड़ी खाई, चूरन खाया और आप ठीक हो गए। कि आपका डर निकालना जरूरी है, आपको मित्रों की बहुत जरूरत होती है, आपके फैमिली मेंबर्स का सपोर्ट, सपोर्ट से ज्यादा ना कि उनका प्रेम बहुत जरूरी होता है। कि जो मैं गठान बोल रही हूँ, इवन कैंसर होने के बाद भी कोई पेशेंट, अगर हमारे मन में क्या भय है, किस बारे में भय है, कुछ फोबिया तो नहीं है, इसके बारे में थोड़ा सा आकलन करें, किसी को बताए। हमारे आप्त जो हम बोलते हैं, आयुर्वेद में आप्त का बहुत बड़ा महत्व है। आप्तोपदेश कहते हैं, कि जो हमारे मित्र हो सकते हैं, जो हमारे रिलेशंस में कुछ हो सकते हैं, क्योंकि सबके साथ हम हमारे दुख बांटते नहीं घूमते ना, कोई कोई होता है कि जिसके साथ हम दुख बांट सकते हैं, तो वो आप होना बहुत जरूरी है हमारे मन की बात कहने के लिए। आप म्यूजिक थेरेपी लो, आप योग समय पे करो, समय पे, आई इंसिस्ट कि समय पे करें, और समय पे नहाओ, क्योंकि पानी पीना सिर्फ उतनी ही जल चिकित्सा नहीं है। तो हम कितने बार पैर धो रहे हैं, कितनी बार हाथ धो रहे हैं, कितनी बार कुल्ले कर रहे हैं, आचमन, आचमन मतलब जरूरी नहीं कि हर बार आप ऐसे हाथ में पानी लेके ही पिए, लेकिन आप थोड़ा सा इसको मेजर करके रखें, और दिन में 32 बार, आपका मतलब 32 बार 3 घुट पानी, इतना अगर आपका हो जाता है, क्योंकि ये ना हर एक के अपने हाइट वेट के हिसाब से बना जाता है। सबके लिए 2.5-3 लीटर पानी इज नॉट नेसेसरी। जिसकी हाइट 5 फीट है और जिसकी हाइट 6 फीट है, उसकी पानी की नीड बदलती जाएगी। और कैंसर में आपका पानी का लेवल आप जितना अच्छा रखते हो, आपकी बॉडी को जितना हाइड्रेट रखते हो, मैं फ्लश की बात नहीं कर रही, ऐसे ऊपर से घटाघट पानी पीने की बात नहीं कर रही हूँ, मैं बॉडी मॉइस्ट रखने की बात कर रही हूँ। तो बॉडी मॉइस्ट रखना बहुत जरूरी है, उससे अपना मन भी अच्छा रहता है। पानी का मन के साथ बहुत पास वाला संबंध है। नहाने से अपना मन बहुत अच्छा रहता है। इवन मोबाइल के कारण जो डिहाइड्रेशन हो रहा है, तो हमारा मोबाइल यूज के बाद हम कितना हाथ और पैर धो रहे हैं, कितना पानी में हाथ जा रहा है, वो बहुत मैटर करता है। और बाकी लाइफस्टाइल तो अर्ली मॉर्निंग उठना और समय पे सोना, गुरुजी ये बहुत हो जाता है।
डॉक्टर प्रीति, कैन वी हैव सम ऑडियंस क्वेश्चंस, वरना सबको लगेगा गौरव सिर्फ मैं और आप बात कर रहे हैं।
बिल्कुल।
Yeah, there are some questions on the Zoom. So if the audience here is feeling shy, we'll start with those questions. गौरव, आपकी आवाज सुनेंगे सब। अच्छा, ठहरो।
मैम, आपने ना एक बायोलॉजिकल क्लॉक के बारे में कहा, जिसको आजकल एलोपैथी में बायोलॉजिकल क्लॉक कहते हैं बॉडी की, कि समय पे सोना, समय पे पानी पीना एंड एवरीथिंग, और सूर्योदय से पहले योग करना या सूर्योदय के बाद योग करना। गूगल में ना बहुत से आर्टिकल्स हैं इसके ऊपर कि आप शाम को योग कीजिए, आप सुबह योग कीजिए तो ये होगा, आप इस टाइम पे जिम जाएंगे तो मसल ज्यादा बनेंगे, और प्रोटीन लेंगे तो ये होगा, प्रोटीन नहीं लेंगे तो ये होगा। इट इज लॉट ऑफ कंफ्यूजन। बट आयुर्वेदा के अंदर जहां तक मुझे पता है कि वो बीमारी से पहले जो की जाने वाला लाइफस्टाइल है उसके बारे में है। तो अगर आप कुछ डायरेक्शन दें, नॉट लाइक स्पेसिफिक कि इसी टाइम पे सोएं, इसी टाइम पे उठें, बट थोड़ी डायरेक्शन दें, तो इट वुड बी गुड फॉर इन जनरल।
एक्चुअली प्रकृति के हिसाब से, अकॉर्डिंग टू प्रकृति, वातज पित्तज और कफज, इसके अकॉर्डिंग कि आप कब उठ रहे हैं, कब व्यायाम कर रहे हैं, कब प्राणायाम कर रहे हैं। इवन सुबह 8 बजे प्राणायाम के लिए हम रिकमेंड नहीं करते हैं। हम फिर, अगर आपको सुबह आपका योग हो जाता है, तो आप इवनिंग में प्राणायाम कर सकते हैं, जो वातज काल होता है, जो सनसेट का काल होता है, या बिफोर सनराइज आप प्राणायाम कर सकते हैं, जहां पे वायु का प्राधान्य ज्यादा होता है। तो उससे जो कफ के लम्स हमारे शरीर में स्तन में बन रहे हैं, कि मेदोज लम्स होते हैं, कफज होते हैं, मतलब उसके भी प्रकार होते हैं, वातज, पित्तज, कफज, रक्तज, मेदोज। तो लेकिन उस सब के लिए वायु बहुत जरूरी होता है। वायु का फोर्स वेल चैनलाइज होना बहुत जरूरी होता है। और वायु सही रहने के लिए हमारा फायर एलिमेंट सही रहना बहुत जरूरी होता है। आप देखते हैं कि अगर कोई सब्जी जल जाती है तो उसका धुआं निकल जाता है। तो नहाने का समय बिफोर सनराइज अगर हम रखते हैं, या ड्यूरिंग सनराइज अगर हम रखते हैं, तो बॉडी टेम्परेचर मेंटेन करने में और वात की वृद्धि, मतलब अवास्तव वात ना बढ़े, चैनलाइज वात रहे, है ना। कुछ डिफिकल्ट टर्मिनोलॉजी हो रही क्या? कि नहाने की वैलिडिटी नहीं रहती है 24 आवर्स नहाए, कि कल 10 बजे नहाई तो आज 11 बजे तक नहाए तो चलता है, ऐसा नहीं होता है। या कोरोना के समय पे हमने बहुत सारे लोगों को ये भी देखा कि दिन भर काम करके फिर शाम को नहाते थे, सुबह नहीं नहाते थे। लेकिन सुबह नहाने से हमारा बॉडी टेम्परेचर मेंटेन रहना और ब्लड सर्कुलेशन सही रहना, ये दो मेजर काम होते हैं। और जब हमारा ब्लड सर्कुलेशन सही रहता है तो हम ब्रेकफास्ट जो भी करें, भले हम राजगिरा खाएं या प्रोटीन शेक लें, लेकिन उसको पचाना इजी हो जाता है। हम क्या खाते हैं वो जरूरी नहीं है, हम कितना पचा रहे हैं, हम कितना डाइजेस्ट कर पा रहे, वो जरूरी है। तो मतलब पहला सुबह उठना, अर्ली मॉर्निंग सनराइज के पहले जब हम फ्रेश होते हैं तो एक नेचुरल फोर्स इंटेस्टाइन में रहता है, तो उसके कारण कॉन्स्टिपेशन नहीं होता है या शरीर के अंदर मल का कुछ पार्ट अटक नहीं जाता है, क्लीननेस हो जाता है जब हम बिफोर सनराइज फ्रेश होते हैं और नहाते हैं। अपने यहाँ पे अभी कार्तिक महीना शुरू हो गया है, तो कार्तिक स्नान का बहुत बड़ा महत्व बताया गया है, खासकर वुमेन्स के लिए। और मैंने भी ये पिछले 8 साल में देखा है, जब कार्तिक स्नान कोई भी लड़की करती है तो पीसीओडी कम हो जाता है, थायराइड कम हो जाता है, और पीसीओडी के कारण आगे चल के जो ब्रेस्ट कैंसर होने की संभावनाएं होती है वो कम हो जाती है। ब्यूटी तो नो डाउट एनहांस हो ही जाती है। कभी कोशिश करके देखिए, शायद इस साल आप में से कुछ लोग कोशिश करके देखिए और मुझे जरूर बताइएगा। कार्तिक स्नान का बहुत बड़ा महत्व होता है, खास करके वुमेन्स हार्मोन्स के लिए।
डॉक्टर, आई हैव वन क्वेश्चन। अभी बहुत सारे ऑल्टरनेटिव ट्रीटमेंट स्ट्रीम्स चालू हो गई है, जो हम लोग ट्रेडिशनल होम्योपैथी, एलोपैथी, आयुर्वेदिक वो सब जानते थे, उसके अलावा भी अभी बहुत कुछ चालू हो गया है। एंड जब भी ट्रीटमेंट का डिस्कशन होता है, पीपल आर दीस डेज वेरी कंफ्यूज, स्पेशली इफ देयर समथिंग लाइक कैंसर, कि मुझे एक्चुअली क्या करना चाहिए। सो आयुर्वेदिक में आप कुछ शेयर कर सकते हैं स्टैटिस्टिक की, कुछ सक्सेस मतलब केसेस आपने देखे हो, या तो कोई एक्सट्रीम केसेस हो जिसमें कुछ वो लोग ने फाइट बैक, दे हैव मैनेज्ड टू फाइट इट बैक, समथिंग लाइक दैट, इफ यू कुड शेयर।
बिल्कुल, जैसे फर्स्ट सेकंड स्टेज तक तो आयुर्वेदिक मेडिसिन से, बेसिक मेडिसिन से ये निकल जाते हैं। थर्ड और फोर्थ स्टेज पे थोड़ा सा अपने को सर्जरी का सपोर्ट लेना पड़ता है। जो आचार्य सुश्रुत ने सर्जरी के बहुत सारे इसमें प्रकार भी बताए गए हैं कि कौन से स्टेज पे कौन सा सर्जरी करनी है, कहाँ पे सक्शन करना चाहिए, कहाँ पे लेपन करना चाहिए, कहाँ पे वो गांठ को पका के तोड़ना है, कहाँ पे कच्ची गांठ भी तोड़नी है। ये सारे डिस्क्रिप्शंस आचार्य सुश्रुत ने काफी जगह पे बताए हैं। तो इसमें हम मॉडर्न साइंस का पार्ट ले सकते हैं, क्योंकि आयुर्वेद में जो एनेस्थेसिया उस समय बताया गया था, अब हम 22,000 साल पुराने की बात करें तो वो एनेस्थेसिया आज हम यूज नहीं कर सकते। भले सुश्रुत जी की जो भी सर्जरी के वे थे वो तो वही है, लेकिन एनेस्थेसिया के लिए हमको मॉडर्न पैथी पे मदद लेनी पड़ती है। फर्स्ट सेकंड स्टेज तक हम प्योर आयुर्वेद योग इसके साथ बिल्कुल जा सकते हैं। थर्ड फोर्थ स्टेज में आफ्टर सर्जरी कीमो के जो साइड इफेक्ट्स होते हैं उसको नलीफाई करने के लिए या उसके नंबर्स कम करने के लिए, रेडियोलॉजी के नंबर्स कम करने के लिए, रेडियोथेरेपी के, हम बिल्कुल आयुर्वेद योग, ये इनको हम ऑल्टरनेटिव नहीं बोल सकते हैं, क्योंकि भारत के लिए आयुर्वेद इज द फर्स्ट रेमेडी। आयुर्वेद इज द वेद एंड वे ऑफ लाइफ। एलोपैथी जो आई है वो लंदन से आई है, वो उनके लोगों के लिए बनाई गई है, उनके हवा पानी के लिए बनाई गई है। नो डाउट उनकी फार्माकोलॉजी कुछ एडवांस होने के कारण एनेस्थेसिया, जैसे मैंने अभी बोला, उसके लिए हमको सपोर्ट लेना पड़ता है। लेकिन आयुर्वेद इज नॉट द ऑल्टरनेटिव मेडिसिन, इट इज आवर फर्स्ट वे ऑफ मेडिसिन, फर्स्ट वे ऑफ ट्रीटमेंट। कि सबसे पहले तो हम आश्वासन चिकित्सा देते हैं कि कुछ नहीं होगा बेटा, घर के जो भी थोड़े से बड़े होते हैं, कुछ नहीं होगा बेटा, निकल जाएगा। ये फर्स्ट ट्रीटमेंट होता है। और आश्वासन चिकित्सा, आशीर्वाद चिकित्सा, योग, ये सारे वे ऑफ ट्रीटमेंट्स है। नो डाउट होम्योपैथी थोड़ा सा बाहर से आया हुआ है, इट इज नॉट आवर वे ऑफ ट्रीटमेंट। लेकिन हाँ, जिसका जहाँ पे विश्वास है, और विश्वास सबसे बड़ी पहली ट्रीटमेंट विश्वास होती है। जहाँ पे विश्वास है, जिस डॉक्टर पे आपका विश्वास है, आप उसी के साथ जाइए। और मॉडर्न थेरेपी भी एक तरफ से आयुर्वेद का बच्चा तो है, दैट इज अ चिकित्सा पार्ट, दैट इज नॉट वे ऑफ लाइफ। तो ये बातें हैं।
We have Dr. Chitkara here. Welcome, Dr. Garvit Chitkara. Dr. Preeti,
हाँ सर।
we'll introduce Dr. Chitkara, but just since आप ये सवाल पे थे, तो एक पैनलिस्ट ने इसमें भी सवाल डाला है जो हम डॉक्टर चित्कारा को भी आगे पूछेंगे। बट एज अ आयुर्वेदा आपके लिए भी ये है कि एक तो उन्होंने पूछा है कि जो इम्यूनिटी लेवल रहता है पेशेंट का, स्पेशली इफ द पेशेंट इज इन 4th स्टेज ऑफ कैंसर, तो कैन दे लीड अ नॉर्मल लाइफ, कैन दे गो टू क्राउडेड प्लेसेस, उनको डाइट क्या होना चाहिए 4th स्टेज ऑफ कैंसर में, एंड उनको शुगर, सॉल्ट या फायर्ड आइटम्स अवॉइड करने चाहिए कि नहीं। ये एक ऑनलाइन पार्टिसिपेंट का क्वेश्चन है। तो एक इम्यूनिटी लेवल के ऊपर है, नॉर्मल लाइफ वो जी सकते हैं कि नहीं। इनफैक्ट ये क्वेश्चन तीनों के लिए आ सकता है। आई डिडंट नो द स्टेज ऑफ पुरिया, बट मे बी शी कैन ऑल्सो आंसर। एंड क्राउडेड प्लेसेस में उन्होंने स्पेसिफिकली पूछा है, उससे कुछ फर्क पड़ेगा तो पहले आपसे हम स्टार्ट कर लेंगे, डॉक्टर प्रीति।
अच्छा, मुझे लगता है क्राउडेड प्लेसेस बिल्कुल अवॉइड करने चाहिए, क्योंकि जब तक हम पूरे तरह से बाहर ना आ जाए। इम्यूनिटी लेवल बिल्कुल हर एक की होती है, शरीर का जो भी आपका बचपन से आपने खाया पिया पचाया है, और मनस्थिति आपकी कितनी है, फाइटिंग स्पिरिट क्या है, इसके ऊपर काफी चीजें डिपेंड करती है। कि अगर हम डर डर के जी रहे हैं, तो थोड़ा सा हम 4 लोगों के क्राउड में भी जाएंगे तो डर के, कुछ सर्दी खांसी भी होती है तो वो मैनिफेस्ट करेगी। मैनिफेस्टेशन का बहुत बड़ा रोल होता है इसमें, फोबिया या डर फैक्टर में। और खाने पीने की अगर हम बात करें, तो बॉडी का टेम्परेचर मेंटेन रखने के लिए थोड़ी थोड़ी चीजें खाएं जो हम पचा सकते हैं, थोड़ी थोड़ी समय पे खाएं। खास करके मैं बोलूंगी कि मनुका या खजूर, इस तरह की जो चीजें होती है, या अभी दिवाली में जो क्या आते हैं वो लाही आती है, धान की लाही बोलते हैं, धान की लाही बहुत काम आ सकती है, मखाने काम आते हैं। मतलब छोटी छोटी चीजें खाइए, थोड़ी थोड़ी देर में खाइए, उसको पचाइए, और बॉडी का टेम्परेचर मेंटेन रखने के लिए हमारी तासीर के अकॉर्डिंग जो हमको पचता है वो खाइए। कि अगर हम एमपी में या यूपी में जाके बोलेंगे कि कोकोनट ऑयल एंटी कैंसरस है या एंटीऑक्सीडेंट है और आप उसको ले लो, तो ऐसे नहीं पॉसिबल है। या ब्रोकोली हमारे वेदर में नहीं काम करेगी, अलसी अप्रैल या मई महीने में काम नहीं करेगी, या वो प्रॉब्लम बढ़ाएगी रादर। खास करके जो पित्तज प्रकृति आएगी, और अप्रैल मई महीने में हम अगर अलसी देंगे उनको कि अच्छी होती है एंटीऑक्सीडेंट, तो वो काम नहीं करेंगे। मोरेंगो थ्रू आउट द ईयर अच्छा काम नहीं करेगा। या आजकल मिलेट्स की बहुत बात चल रही है, तो सारे मिलेट्स थ्रू आउट द ईयर सब रीजन में काम नहीं करेंगे। तो इसके लिए आपको थोड़ा सा स्पेशलिस्ट का सलाह की जरूरत है। और सिर्फ कार्बोहाइड्रेट, प्रोटीन्स, फैट्स इसके ऊपर न जाते हुए षड्रसात्मक आहार जो होता है उसके, भगवान को हम जिस ऋतु में जो त्योहार आता है वो त्योहार में हम भगवान को जो भोग चढ़ाते हैं वो हमारे लिए सही होते हैं।
So same question to Dr. Garvit. Would like to hear from you.
So, आपने स्टेज 4 कैंसर के बारे में बात किया, मैं मान के चल रहा हूँ आप स्टेज 4 ब्रेस्ट कैंसर के बारे में बात कर रहे हैं। जब आप स्टेज 4 कैंसर की बात करते हैं तो ऑलराइट, परफेक्ट, दैट मेक्स माय लाइफ इजियर। No, I am from North India. Hindi is not as bad for me. It's quite comfortable, but English is, since it's the language of education, it makes it easier for me to talk on it. That's all. So, when you're talking about stage 4 breast cancer, I am, there'll be people who are stage 4 but off treatment. Like Dr. Saab currently correctly put it. If you're still under treatment and receiving chemotherapy, that is the time when you should be avoiding crowded places. And crowded places, especially when you have a room like this, which is air conditioned and the air is recirculated. So what happens, out of the 100 of us who are sitting here, one of us having that infection is going to get recirculated through air and reach you, and your immunity is already down. So in that process, when you get your immunity is down, your chances of picking up an infection, whether it is airborne or otherwise, is high. So that is the time when you should be avoiding crowded places. But if you're not on on chemotherapy or immunotherapy, in those cases, your immunity is not at stake. Your general immunity to fight against infection is not at stake. And in those times, you can be anywhere you like. So, say for a post-surgical patient that I would have operated today, I discharge them the next day and I tell them to, if they want, they can go for a movie the day after. But the thing is, the idea is for them to be away from the thought of cancer for some time. And I know that most of them are going to get chemotherapy in 3 weeks' time. So this is the time where they want to have a little bit entertainment, and that's absolutely fine. Now so idea is, when there is active treatment on, we avoid crowded places, especially crowded places which are closed and air conditioned. So you can use open crowded places. Going for a walk in a garden where there is enough fresh air, it's absolutely fine. Difficult to find a garden in Mumbai like that though, but still. So the second bit is when you ask about what you can eat. For patients, again, on active treatment, my advice is that you eat anything that is locally produced and off the season, like Dr. Saab correctly put it again, which is of that particular season, locally produced, not processed, not out of a packet, cooked well and eaten. Whether it is a vegetarian diet, non-vegetarian diet, doesn't really make a difference. Some of us have had this thing that there are a lot of questions about whether I can eat red meat, whether I can take dairy, whether I can take sugar. None of them have been proven to have any carcinogenic, they don't cause cancer per se. A lot of WhatsApp messages going on which say that cancer cells are dependent on glucose, hence please do not consume sugar. If you deprive them of sugar, they will die of their own. You not need treatment. Actually, all cells depend on sugar for survival. It's just that we call it glucose when it reaches us, and we change it into energy and utilize it. Now, if you stop sucrose, that is the table sugar that we use, does it mean that the sugar going into your body has decreased? No. The carbohydrates that you use, the fat that you use, the protein that you use is also going to ultimately get converted to glucose, in the sense that that is going to get converted into ATP and bring you energy. So stopping only one source of glucose is not going to help. Anyways, your body requires glucose. So if you're not a diabetic, please have sugar. There is no problem with that. If you are not a hypertensive, have regular amount of salt. Otherwise, avoid salt as much as possible, or decrease the amount, or don't have added salt on top of that. Fried food is something that he asked this thing. Look, fried in general is not great for you. whether you're a cancer patient or not. Right? Especially, and I keep saying this in most of the awareness talks, is, and this is, I think, if I say this today, and I'm sitting amongst professionals here, and I'm sure each one of you will agree. When you go back to your kitchen, if you've had puris in the morning, I'm sure there'll be a separate vati of tel which will be kept next to the this thing, which you want to use to cook the evening meal or anything, right? That's not. Okay. What happens is when you reheat oil, it brings up trans fats, and these trans fats have oxidative properties which can damage your DNA, which can cause cancer. I'll give you an example of trans fats. Everyone's had samosa, right? Have you ever been to the shop where samosas cooked? Yes. Have you ever tried to touch the kadai? What color is it? Black, right? You try and touch it. It's this sticky substance.
Yeah.
You know how this forms? Because of the reheating of oil that the halwai does every single time until the oil tastes bad, he'll keep using the same oil. We are doing the exact same thing by reheating oil at home. None of us are going to be Dubai ka sheikh by saving that oil. So please don't reheat oil. And fried food as such, if it is cooked in fair amount of, a fresh oil and cooked fresh and eaten, not stored and eaten later on, is okay even in stage 4 breast cancer. Right. Anything else that I missed? No.
Thank you. Puriya, anything means practically have you avoided crowded places or anything? Your
Yes, I
experience
did.
point of
Yeah,
view.
yeah. So I was diagnosed in, so my stage was stage 2 to A to D. So I think I followed whatever both doctors have, very rightly put. And so home cooked meals, avoided processed food, sugar, thoda bahut to anyway hota hi hai.
Yes.
But I avoided crowded places. And yeah, I think.
Doctor, since you have joined us
Yeah.
late, I will first take a few minutes
Sure,
just
ma'am,
talking
please.
about.
First, before I didn't get to say sorry to all of you. I'm really sorry. It was because of a surgery that I got delayed. And this is something, I'm not using this as an excuse. It's my nature of work, which I have to do. It's difficult to. Thank you. Sorry. सर डेडलाइन के बाद 10% तो एक्स्ट्रा देके काम चल जाता है, यहाँ पे 10% है नहीं.
About Dr. Garvit Chitkara. He's a senior consultant at the Nanavati Max Institute of Cancer Care, Breast Care Program, Cancer Reconstructive Surgery Program, in the Nanavati Max Super Specialty Hospital in Mumbai. With 15 plus years of experience, he's been the Associate Professor, Surgical Oncology, Breast Surgery at the Tata Memorial Hospital, also been the Senior Resident at Tata Memorial and the Senior Resident at the Delhi State Cancer Institute. That's why the ability to talk in Hindi, right?
Brought up also there.
Brought up there. Sir, thank you so much for gracing our dais here. And I did that to the other two ladies, so I have to do it to you as well. I've written 2 lines about you. This particular cause is very close to me. I lost my mother to breast cancer in 2000 when my daughter was just about 1.5 years old. I was only happy that she saw my daughter's first birthday, because that was one thing she said, that I want to live to see her birthday. So when we decided at BCS that we would have, and Sangeeta Ben has been the mentor and the whole brain, it's her idea to have this talk. So I said, I need to associate with this. So when I was part of this whole discussion and we had the fortune of talking to all of you, it brought back some memories to me, and today evening also. So बड़ी मुद्दत के बाद एक जख्म को फिर छेड़ेंगे. बड़ी मुद्दत के बाद एक जख्म को फिर छेड़ेंगे. मरहम आप लगा देना, हम दुआएं तुम्हें अपनी देंगे. Because I think that's one, when I've seen the cancer surgeons, the oncologists, I think they realize that the family also goes through it. Because if you go to any other doctor, if, you know, anybody needs to go to a dentist or an ophthalmologist, family doesn't accompany. But it is a cancer surgeon who faces the whole family. Jaise Puriya ne kaha that she had the whole family going in and the doctor said, please invite the others also if they're sitting out. So thank you, because it gives us an opportunity to hear your experiences, and the floor is yours. The 5 minutes which we allot, but we are not going to put a timer. So please go ahead and tell us what you think.
Thank you very much, ma'am. And I'm sorry about your mother.
Sir, sorry.
No.
Thank you, Narayan Bhai, for reminding me. Sir, हमारे तरफ से thank you for coming, and we will like to present a small memento to you so that you can remember us आगे जाके. May I request Narayan Bhai, आपने याद दिलाया? संगीता बेन, हाँ, साथ में, हम साथ हैं.
पिंक शर्ट पहना है तो
Thank you, ma'am. Thank you. सर इसमें कोई डाउट नहीं है, तो एग्जाम नहीं क्लियर होता आज तक तो So I think 5 minutes that I've got, I want to, and we've just finished Pink October, and we know why we celebrate Pink October. We celebrate it, we don't observe it. It's not a Jayanti. It's a month that we celebrate for the patients who fight day in and day out, and a lot of them make it. Some of them don't, I'm sorry. But it's a salute to their courage for whatever they have done, and how it's a difficult journey, no doubt, but it is because of them that we have learned so much, and we are able to offer back to the next crop of patients that comes. Unfortunately, right now, breast cancer is the most common cancer in the world for women. And it is, for India also, 26% of the total cancer load in women is breast cancer. And it has been so for the last 5 to 6 years. Earlier it was cervix, but because of the better hygiene practices, we've moved to breast cancer, and breast cancer is a westernized disease. So it's associated a lot with our lifestyle. So hence, especially in the cases where we get it in older age, it is associated with lifestyle. So because we are westernizing more, we are getting breast cancer more, right? So moving on to just small things that I think all of us should know. And the problem that I face a lot of time when a patient is in front of me and comes with that 6-centimeter tumor, and I ask them, I mean, you look like a lady who has all the, everything is available to you. The internet is there. You have a smartphone. How is it that you've missed a 6-centimeter tumor and you've not come? And the answer is always the same. I didn't think this was cancer because it was painless. So the one take-home message that all of us can take is a painless lump in the breast, axilla, or the armpit, or the neck is the more dangerous lump. A painful lump will definitely take you to the doctor because it's causing trouble. It's the painless lump that we ignore, that we wait for, like Ganpati, then New Year's, then 10th mein bacche ka exam. We keep on waiting for things while it grows. Please don't give it that chance. And I'm telling you why it makes a difference. I'm currently working at Nanavati. I've spent good 10 years at Tata Memorial Hospital. For some time, I was at New York in Memorial Sloan Kettering Hospital also. And I'll tell you by example, if I were to see 100 patients in Tata Memorial today, I would say 60% of them would come in stage 3 or stage 4. Only 40% would come in stage 1 or 2. What does that translate to? It translates to 60 to 70% of them living for 5 years disease-free. Only 60 to 70% of them living disease-free for 5 years. Similarly, 100 patients seen at Memorial Sloan Kettering, New York, 90% will present in stage 0 or stage 1. Stage 0 is when it is picked on mammography and there is no actual tumor, it's just microcalcifications. Stage 0 or stage 1, the survival rate is 95% disease-free at the end of 10 years. And they're not dying after 10 years, they're still continuing. Neither are the 60% here are dying after 5 years. They are still continuing, but at the end of 5 years, when you check, 60% have. Nanavati, now I'm on a private setup where I find women a little more aware. The figures is somewhere in between, the 60% and the 90%, 95%. Are the doctors better in New York? No. Are the machines better or the care being given better? No. It's standard of care in both the cities. I've worked for a very long time here and I can vouch for it that it is standard of care provided someone is able to afford it. So it's standard of care here, it is standard of care there. Doctors are the same, then where is the problem? The problem is the size of the tumor. Patient come late because they thought this is not cancer. The first thing is denial. They say, मुझे तो हो ही नहीं सकता. Second is, ये cancer नहीं. Third is delay. They keep doing the same thing. Ganpati, Diwali, New Year's, बच्चे का exam, husband ka promotion, retirement, something or the other is going on. And I am referring more to women. It doesn't mean that breast cancer does not happen to men. Breast cancer also happens to men. Although the chances are less, in 100 breast cancer patients, one is always a male. So when you've seen your male breast cancer patient, I can, by guarantee, I can say if I go back and look at my data, I would have seen 99 before that. So the number of male breast cancers you've seen, that is the number of patients that you've treated in 200. Okay. Now, this is the most common symptom. What are the other symptoms that we need to watch out for? Other symptoms are dimpling of the skin of the breast. Dimple on the cheek is good. Dimple on the breast is not. Nipple discharge, especially if it is blood-stained, is one of the most common symptoms of breast cancer. Right? Then, and early breast cancer. All right. When you move on to axilla, if there's a lump in the axilla is the armpit. If there's a lump in the axilla which is painless, could be cancer. Need to see a doctor. Nipples, when a mother feeds the child, what happens is the nipple cracks a little. It becomes dry. That dryness, we have nip care creams now, which basically take care of them. But that dryness, if it comes and on scratching, if there's a little bleeding, that could be an early sign of cancer in a non-lactating mother, not in a lactating, not non-breastfeeding lady. So in a non-breastfeeding lady, if there's dryness of the nipple, which you scratch and it causes a little bit of bleeding, could be a very early sign of breast cancer. Do not ignore it. See a doctor immediately. So these are few signs and symptoms that you should be aware of. What you should eat, what you should not eat, I think Dr. has already answered. So I'm not going to go there on this thing. How treat it is one small thing that I want to tell you. There are multiple therapies available now. We do surgery, which more often than not we are able to save the breast now. Breast conservation surgery is now the norm. It is not an exception. It's a norm. We conserve breast for most women, and it is oncologically safe. Cancer-wise, it is safe to save the breast. You don't need to remove it every single time. We give chemotherapy, but chemotherapy now is required for less number of patients. We are able to avoid chemotherapies in about 50% of patients after a certain age group. Younger patients, we are not able to avoid, but for older patients, we are able to avoid chemotherapy, especially if they are hormone positive. Hormone therapy are tablets. Okay, chemotherapy, one more line. Everyone's scared about hair loss. Everyone's scared about multiple, symptoms and multiple side effects that chemotherapy comes with. Yes, it has side effects. The hair go, but 100% of the hair come back. But now there are technologies available where we can prevent hair loss also. Most of the time, if you use those caps, and most hospitals have it, are also definitely does because we use it regularly. The hair loss can be prevented. Other than that, the other side effects which are there can be avoided with the kind of drugs which are available now. The best way to avoid it is avoid chemotherapy. How do you avoid chemotherapy? Report early. Chemotherapy is required only in certain cases, only in advanced cases. Younger women do require chemotherapy, that we can't change. But for older women above 50 years of age, postmenopausal age group, we can avoid chemotherapy in a lot of them. Radiotherapy is again X-rays, which are treating the local area. There is targeted therapy, there is immunotherapy, there is hormone therapy. Idea is that every single patient gets the treatment according to the needs of that particular patient. It's tailor-made for that particular patient. So there is no comparison between. So standing outside my OPD when the lady enters in, and I know that obviously they have talked to each other. You told her this, you've not given me this. And why is she getting this and I am not, you're giving me more. Why is this? You have to tell them that, look, everyone is on a different line of treatment or a different this thing. So idea is, but the good part is, I told you a number of therapies. Less are required if you report early. Okay. So if you pick it up early, less will be required. Last part of my 5 minutes is, how do you early detect it? For early detection of breast cancer, there are 3 steps. One is self-breast examination. Do it yourself at home once a month. For a woman who's not had her periods, who's still premenopausal. So on day 7 to day 10 of the period. So if someone had a period at day 1, say on 1st of November, then 7th to 10th of November would be the time when she should examine her breast. For a woman who's had menopause, can examine any time of the month. This is because the hormonal changes in the body reflect in the breast. So if you're examining yourself on other days, there are chances that you might miss something. Between 7th to 10th day, the breast is more supple, and hence the examination is more easy. You're able to pick up things. Self-breast examination to be started at 25 years of age. Young age is not a guarantee against breast cancer. We have an example here. The youngest that I have treated is 3 years. It was genetic. She's absolutely fine. This is not to scare you. It's just to tell you that it can happen to anybody. So, mujhe nahi ho sakta is not an answer. You have a lump in the breast, please see a doctor. Okay. A lot of time I am asked a question, how do you make out a difference between a cyst and a benign tumor and a malignant tumor? I said, you don't find out. You please come. So if you find out, then what am I for? So where was I? Self-breast examination. Second is clinical breast examination. A recent study published by our own center, my ex-center, Tata Memorial. And this is based on women in Mumbai, showed that if you start clinical breast examination at 35 and do it annually, clinical breast examination is examination by a doctor, do it annually, it reduces the chances of you getting an advanced breast cancer. You catch it early. And like I said, you catch it early, you survive more. You catch it early, you have less therapies. You catch it early, you have less kharcha on therapies. You catch it early, you go back to the life that you came out from, as you were. Last is screening mammograms. Screening mammograms are to be started at 45. They can be started anywhere between 40 to 50, depending on what your risk is. Why I've said 45 is because I said 25 for self-breast, 35 for clinical breast, and screening mammograms at 45. Done once in 2 years is okay, but if you can, one annual mammogram starting at 45 will help you early detect. If you early detect all the things that I told you. All right. Thank you very much. Those were my 5 minutes.
You just said that the trend is to not do a mastectomy, but to try and save the breast. But is it so that the relapse is there more in lumpectomy?
That is what I wanted to. That's why I said it's oncologically safe. So there are about, when we recommend a treatment, to anybody, where do we read it from? It's not, I mean, it's there in the books, obviously, but where does it come from the book, come into the book? It is generated by trials. Trials is by conducting experiments. And there is a level of evidence which is said for everything. So if I say, in my opinion, this is right, that in my opinion is called as an expert opinion, no matter what level of an expert you are in the world. It amounts to level 6 evidence. That's the lowest level of evidence. The best level of evidence is randomized control trial, where you take a group of patients where you did a lumpectomy, and you take a group of patients where you did a mastectomy, and you observe them over a period of time and see what is their survival. There are 6 randomized control trials, all with positive results, which have shown that breast conservation surgery is as good as a mastectomy, without 1 day change in the lifespan of the patient. So there is no risk of recurrence. What do you know about, what do we know about recurrence? There are 2 kinds of recurrence. One is a local recurrence, where the cancer comes within the site of where the tumor was. The other is systemic recurrence, which happens in the body, where what we call is spread ho gaya, yeah, metastatic disease. Where do you think the threat to life comes from? Obviously, the systemic disease, right? What surgery you do does not change what is the threat to your life, what is your risk of systemic recurrence. Hence, surgery does not change the kind of, what your overall survival is going to be. Surgery only changes what is your local survival going to be. And there is no difference in local survival. So breast conservation surgery is as good as mastectomy and has been proven beyond doubt. I know it is difficult to reason on, obviously, if this is the organ involved, and if I remove the organ, it is not going to come back. Unfortunately, that's not true. Breast cancer at the onset, when it started, it already is a systemic disease all over. So if I have removed the cancer, why, and it is now, if I do a PET CT, is completely zero. Why do we need to give chemotherapy or hormone therapy? Because we are treating the systemic part of the disease. Extensive local therapy is not going to treat the systemic part. So for mastectomy, which is a more radical surgery, is not going to treat the systemic part. Hence, the change in survival is not going to happen. So if you can just get good margins, radiate the breast, that's enough.
Okay, great. This is a very different answer. I had not heard of this. Another thing, you spoke about mammography to do after the age of 55, but generally 45. In eastern part of the world, we are not so much for mammography, maybe the cost or maybe the accessibility or the awareness. And also, I've heard from a very well-known oncologist of Tata Memorial Hospital only that
Dr. Badwe. I am making he's my teacher. I can't.
the dissection was done of so many corpses of women, and there were.
I know the example that you're telling. You're talking about the French study. You're talking about
Okay.
So
I mean, if it is picked up on mammography, and which may not have been picked up if you had not done a mammography, and you would have lived a healthy life throughout. So something you pick up so small and take a treatment, maybe it may not grow to become malignant.
So there is one easier explained. I'm not going to contradict him. He's my teacher. But what I'm going to say is, look, the survival between us and them in the western part of the world there is a definite survival difference in that. You agree with that? I just gave you an example of 60-70% and the 90-95% survival. One of the reasons that is there, it is because of the fact that they're doing systemic mammography for everybody. I didn't say it for everybody. I said it for anyone who's more than 45 years of age. You know why that number? Because it's only after that age group that the benefit associated with the test outweigh the risk associated with that test. And in that, risk involves the over treatment that Sir talks about and what you're referring to. That if I pick up a cancer, which is a completely, useless cancer, which is not going to grow, which is not going to cause death, it may just go on living with you for eons and then die when the person dies. That amounts to over treatment, right? If I find out a cancer in the breast and I treat it, it's over treatment if it was never going to spread. Correct? That's what you're saying. Now, after 45, the chances of, the incidence of cancer already increases. So as the age grows, the incidence of breast cancer increases. So once you've crossed 45, your chances of having a cancer which is new, which can kill, is higher. That's why the risk benefit ratio is much better after 45 for early detection, for better survival. I mean, earlier than that, yes, there is no benefit of that. That's why we are not doing any mammograms for earlier than 45 years of age.
Any questions from the audience?
Doctor, you mentioned that the incidence of breast cancer has increased because we have westernized more.
Yeah.
What exactly do you mean by
So,
westernized?
when we talk about the risk factor, let's take a step back. How does breast cancer happen? The most common cause for breast cancer, or the most common risk factor for breast cancer, is central obesity. The obesity which is around the abdomen and the buttocks. It's one of the most common risk factors for breast cancer. By westernizing, we've increased the amount of stress that we take. We've increased the amount of fast food that we eat. We've increased the amount of obesity that we have. That has increased our chances of getting breast cancer. That is westernization, and it is very clearly seen. If you see Bombay Cancer Registry, Mumbai Cancer Registry, or if you see the Barshi Rural Cancer Registry, Barshi Rural would be 9 in 1,000 cases. Bombay would be 32 in 1,000 cases. That's the difference. 1,000 healthy women, sorry. That's the difference. So if you, and the only thing that you can say is Bombay is definitely more Western, not in location geographically, but Western as how we live our lifestyle. Okay. And it is same as we go on to the more Western world. It goes up to about 90 from 32. That's the number, and that's westernization. Urbanization, westernization, however you want to put it. Yes, ma'am.
Have you noticed an increase in cases after COVID?
It's a very common question, ma'am. Thank you for asking it. We've seen increase in number of axillary lymph nodes after COVID, after the vaccination. But has it truly amounted to any increase in number of breast cancer? No study has been published which has said that. Have I noticed? No. I was working in a government hospital earlier. I'm working in a private hospital now. I've seen equal number of cases. It's not increased tremendously. It's the same. Had it increased tremendously over such a short period of time, because breast cancer is a slow disease. It doesn't grow in one day. It takes years to grow. So if it is really causing it to increase in incidence, we've not seen that wave coming yet. If it is truly causing, we may see it. We don't.
Not only breast cancer, I'm talking about overall. Overall cancer.
No,
Thank you
but
so
no,
much.
madam. No.
I have one more question. Sorry.
Yes.
There is a lot of information online which keeps saying use of microwave, aluminium utensils, Teflon coating, this, that, and the other, in terms of how things have evolved in the kitchen.
Yes.
So, is it a contributing factor to cancer per se?
Various studies which have seen radio waves, one, then your mobile waves, this thing. None have categorically pointed out any of those things that you mentioned. Microwave, you said. No, it does not increase risk of cancer in general. Okay. Reheating of food, yes, it does. Storing and saving of food later for later use preserving food in the forms of pickling also increases the risk. So if you're constantly reheating, that is spoiling the food, not the microwave. It's the food which is being spoiled. Teflon is a very inert material. It doesn't go into, even if the particles of it went into your body, it will not react with it. It will be passed as stool. So that's not something which is should, as by the nature of, there's no study which proves it, neither there is a study which disproves it. But Teflon as a material is very inert. It should pass through body without causing any harm. Aluminium, no, definitely no.
Just the same,
Yes.
following up question on that. What about plastics, sir? We're hearing a lot of
Microplastics have known to cause cancer. So usage of plastic has to be stopped.
And the
Especially
water bottles.
Sorry?
Water bottles.
If you're not storing very hot or very cold fluid in plastic bottles, it should not harm.
Otherwise it is.
Otherwise, yes.
Okay.
So coming from both these questions, we see all are working and having food, probably reheated food regularly.
So what by reheated food, I meant something that is being stored for like in the fridge, reheated, eaten, still not completed, and again goes back to fridge, again reheated, and then.
Okay. So the normal practice is to carry your lunch and then reheat it in an oven on a daily.
So that does not increase. Sorry. Yeah. Otherwise, now the companies will have to make kitchens. So in a lot of these talks, when I'm going to corporates, I say that you need to bring the stress down. And the manager looking at me is like, take some chuttis, go for holidays.
So, yes, doctor.
Like, are they, how invasive it is, and
Invasive?
in the sense, are there keyhole surgeries possible now? Or?
So keyhole surgery for abdominal is possible. Robotic is possible. People are experimenting on breast surgery by robot, but unfortunately the incisions are still as big. But the good part is breast surgery per se is a superficial surgery. You're not going into any body cavity which should cause, it doesn't cause a lot of complications. By body cavities, I would mean if I were to operate on the lung, I would have to open the chest. If I have to operate on the intestine or the abdominal organs, I'll have to open the abdomen, where the amount of complications will be much higher. When I'm operating on the breast, there is no, life-threatening complications. If you're a decent surgeon, no life-threatening complications will happen. So yes, a surgery is invasive, but we are able to reduce the amount of surgery that we do. Earlier, it used to be that we would remove the breast, we will remove the underlying muscle, we would remove the glands in the neck, we will remove the glands in the axilla. Now we remove only the tumor. We inject something around the tumor to figure out which glands to remove from the axilla. And it is a radioactive dye that we put. And we have almost all of us have gamma cameras in our OTs, and we see from gamma cameras where the radioactivity is coming from. And we remove only those glands. And if they are negative, and they're tested there and then in the theater. We have labs in the theater which are known as frozen section labs. They are checked there and then in the theater. If they say it is negative, we don't proceed further. We stop there. So yes, we're trying to make it as less invasive as possible, but keyhole, no, not yet.
So many times in any of the medicine when we go, so people say that, allopathy versus Ayurveda. So they say don't do both. Sometimes they say if you do this, you don't know which is impacting your body to continue. We have both the doctors on the panel here, so I would like to understand that in these cases we do which side of the table, or they can coexist both together.
Should I answer first? Not just shaking it.
Okay, the president has asked the question. It was in my mind, but I said I don't want to ask it.
I'll tell you what I tell my patients, and with all due respect, my father is an Ayurveda Acharya, so that's so. and I have patients who have taken homeopathy, who've taken Ayurvedic, and will come. The idea is we don't know how the interaction between the two line of treatment comes into play. I always tell my patient that if you are on active treatment of one line, don't mix it up with the other. Nor do we know whether they are additive in action or are they additive in side effects.
Exactly.
Like I said, when a treatment is recommended to a patient, it goes through a rigorous testing in the lab first, in the animal models first, after that, in the human volunteers, and then patients. Then those are also phased. You start doing it on patients who are already, say, stage 4. And then you apply it to patients where life is assured, like, you're doing it for stage 1. So that's the trend that we follow. Has there been any trial which has compared Ayurveda with allopathy or Ayurveda with the anti-cancer medicines that we use? Unfortunately, not. That's a space that needs to be explored. In fact, there are some current trials which Dr. Badwe is starting, which are pretty good in terms of trying to look at herbal products which can help. I don't know the details of the trial, and even if I knew, I could not say them here. But he's one man who has a vision about all this, and he's really working hard for this.
नहीं सर, मुझे ऐसा लगता है शायद काफी लोगों को पता नहीं है, लेकिन आयुर्वेद में भी जो कैंसर के ऊपर मेडिसिन दिए जा रहे हैं, भले हर्बल हो या मेटालिक हो, मेटल्स भी काफी दिए जाते हैं, लेकिन वो वही होता है जो एनिमल ट्रायल्स होते हैं, फिर ह्यूमन ट्रायल्स होते हैं, उसके बाद में पेशेंट को दिए जाते हैं। और लैब टेस्टेड मेटल्स रहते हैं कि हर कंपनी लैब टेस्टेड नहीं होती, वो थोड़ा सा अपने को देख के पेशेंट को देना पड़ता है कि हम किस कंपनी का दे रहे हैं, लैब्स कहाँ पे है, लैब टेस्टेड मेटल्स कहाँ पे है, कि जैसे डायमंड का भस्म है या ताम्र का है, मतलब कॉपर भस्म है, तो ये एक्सपर्टी का पार्ट होता है, और कहाँ से वो आ रहा है, किस कंपनी से आ रहा है, उसके ऊपर काफी डिपेंड करता है। और हर्ब्स का भी वो टेलर मेड रहता है कि एक अगर मैं हल्दी किसी को दूं तो जरूरी नहीं कि दूसरे को भी मैं हल्दी दे दूं, वो पेशेंट के प्रकृति के ऊपर डिपेंड करता है। और नो डाउट कि आपके ऑथेंटिसिटी की ड्रग्स कहाँ से आ रहे हैं, मेडिसिन कहाँ से आ रहे हैं, उसके ऊपर ये मटेरियलाइज होता है। और आजकल आयुर्वेद में जो आयुष की रिसर्च चल रहे हैं, CCRS का है या किसी काफी IITs के साथ भी चलते हैं, तो वो लैब टेस्टेड ही होते हैं, एनिमल टेस्टिंग और ह्यूमन टेस्टिंग उसमें होते हैं।
एक्चुअली डॉक्टर प्रीति, काफी लोगों को आयुर्वेद पे विश्वास है, किंतु एसेसिबिलिटी नहीं है। आयुर्वेद डॉक्टर ही कोई पता नहीं है। मतलब अगर कोई पेशेंट एलोपैथी ट्रीटमेंट ले रहे, उनको विश्वास है कि कोई हॉस्पिटल जाए, वो जो डॉक्टर है वो सही डॉक्टर है। मतलब अब हिंदुजा हॉस्पिटल, बम्बई में हिंदुजा हॉस्पिटल जाओ या जसलोक जाइए, टाटा हॉस्पिटल जाइए या नानावटी जाइए, कि वो डॉक्टर फंसाएंगे नहीं। लेकिन वो आयुर्वेद में ऐसे विश्वास नहीं हो रहा है कि ये सही ढंग का डॉक्टर आयुर्वेद है कि नहीं।
नहीं, ऐसा होता है कि जितने नंबर्स, जिस तरह से एक्सप्लोजर मॉडर्न मेडिसिन को मिला है कि अगर 100 डॉक्टर्स पता होते हैं तो उसमें से 10 अच्छे हैं। अब आयुर्वेद के उतने डॉक्टर्स पता ही नहीं, क्योंकि एक्सप्लोजर उतना है नहीं। उनके हार्डली 5 डॉक्टर पता होते हैं, उसमें से 2 विश्वास आप रख सकते हैं। और हर डॉक्टर हर पेशेंट के लिए नहीं बनता है, या मतलब एक फ्रीक्वेंसी मैच होना, विश्वास होना एक अलग बात होती है। कि हम सिर्फ आयुर्वेद पे विश्वास करते हैं, ये सिर्फ चिकित्सा का पार्ट नहीं होता है, वो आपके लाइफस्टाइल का पार्ट होता है। आपके लाइफस्टाइल से वो पता चलता है कि आपका आयुर्वेद पे विश्वास है कि नहीं है।
Sir,
There was a question.
yeah, I have a question that now transgenders also do breast implants like silicone implants, or they take medicines to increase their breast. So do that cause breast cancer in future? Or you can say something on that?
Yeah, I'm very happy that you brought this up because it's not just transgenders, it is also women who are looking for augmentation mammoplasties where we want to put in implants into the breast to increase the size or increase the cleavage or whatever. Now, earlier, what it used to be that we used to use or we still use when we get smooth implants. They're filled with silicone and the outer surface is smooth. The problem with smooth implants is that they rotate within. They just, if you're sitting, it can rotate while you're moving. The implant can rotate, and it's a very, like, it's not a good feeling. That's what has been reported. So they started making textured implants. So they would get locked there and they would not move. The textured implants, 1 in 1 lakh, started causing a type of a lymphoma, not breast cancer, but lymphoma. So they had to be banned. And now what we get is nano textured implant or micro textured implant, where they have been used for a good number of time and is not increasing the risk of breast cancer. Now, if that is one, this thing about the implants, if I've answered that already. Now, the other thing that you asked is if you're taking hormones for increasing the size of the breast. That, like, the hormones are already implicated for causing breast cancer or increasing the risk of breast cancer by. So if you're taking hormone replacement therapy for a long period of time, that increases your risk. Even if you're taking oral contraceptive pills for a long period of time, I'll define that if you're taking it for more than 2 years, which is an ongoing use, increases your risk. Or in your history, if you've taken more than 10 years of oral contraceptive pills, which are also hormones, increases your risk of breast cancer. So hormone being taken for breast augmentation are also the similar kind of hormones and will increase automatically.
So, sir, if a person has gone through SRS surgery, after that SRS surgery, if she is taking hormone tablets, so it's okay or not?
If after that they're taking hormone tablets, is it okay or not? I'll tell you why this question foxes me is when we're looking at answering a question like this, we are in my mind, I'm going through evidence, whatever I've read and this thing. Unfortunately, there's not much available on transgenders. There's not much available post SRS surgery. I will definitely read up and get back to you on this one. And I will try and find out if there is evidence available on this. And I will definitely try and answer it.
Thank you
That's a
so
question
much.
that will fox me for a long time. Why is it over? Oh, then it's fine. I'll pick them up and take them home.
Dr. Priti earlier mentioned that PCOD, women who have PCOD earlier, they have more chances, or probably, they are more susceptible to cancer. So if, PCOD is quite prevalent in younger, especially college students, etc., and even, after having a child. So how does that kind of woman prevent? Is there any preventive thing to
Yes,
avoid?
there are. So it's a good thing that you brought up. PCOS or PCOD, polycystic ovarian disease, is stemming from the same problem. The same problem is higher amount of hormones. Where is it coming from? What are the sources of hormone? Special naming, like estrogen and progesterone are the two hormones. Estrogen is the one which has been implicated more. There are some studies which show progesterone also is involved in causing breast cancer or PCOS or this thing. So when I'm talking about estrogen more in this sense, there are two sources. One is the ovary, which you can shut or decrease by giving some drugs. The other is your fat around the abdomen and buttocks, which is central obesity. So if we reduce this, we will reduce PCOS, PCOD, and also the risk of breast cancer.
Okay.
So it's actually two different problems stemming from the same thing.
Okay.
That's why it appears that PCOS is causing this. It's just that both the same woman had a problem which was because of high estrogen, and now has another problem because of high estrogen. So if you reduce that thing, if you reduce the obesity, your hormone levels in the body, and how are you going to reduce obesity? Exercise and diet,
and clean food. Yeah.
right? So exercise and diet, both, not either of them alone will not work. If you're exercising, you're already decreasing the amount of inflammatory cycles that are going on in the in the body. So that itself is bringing down. It is producing a lot of endorphins, which bring your stress down. So you've brought the stress down, you've brought obesity down, you've brought estrogen down, you've reduced the risk of breast cancer, you've reduced the risk of PCOS, and you've answered the question yourself.
Nice.
So just one connecting question, in PCOD or PCOS, there are a lot of hormonal medicines which are given to, correct the
Oral
imbalance.
contraceptives.
And there are other even hormonal medicines given to a woman probably to correct the menstrual cycles or any other such issues. Does these kind of prolonged medication also have any side effects?
So, like I said, most of the times what we're using are external hormones, which are estrogen and progesterone and different. So earlier, the dosage which were available were much higher. The dosages which are used now, obviously, all the doctors, including, I mean, not just the cancer doctors, the gynecologists are also cognizant of the fact that high hormones cause cancer. So they will not give it for a very long period of time.
Yeah.
And very long period of time is 10 years.
Okay.
It's not like few months is not going to cause it. So the dosage available, जिस पे research हुआ था, उससे अभी आधी है. उसमें भी we are giving it sparingly when it is absolutely necessary. Otherwise, our first treatment is please exercise, please lifestyle modification and everything to reduce PCOS. And then we go on to hormones for even menstrual problems and everything. We go on to hormones as last resort, or maybe an intermediate resort, last resort or something else. But that is how we, decrease the amount of risk associated with that.
Okay.
I
Thank
think
you
the
so much.
same question was asked on chat also, that during menstrual, for the cramps, some ladies take pills.
Yes.
So
Correct.
is there any nexus?
No. For cramps, what we are giving are antispasmodics. The antispasmodics don't increase the risk of cancer. For periods, what we are giving is for heavy bleeding is hormones. So for heavy bleeding, I'm not talking about pause or the other medication to stop bleeding. I'm talking about hormones which are given to bring the cycle back to regular cycles. So those are hormones. They should be given only sparingly when necessary. And once the cycles have resolved and come back to a normal flow, normal timing, then stop.
So I hope that has answered the question put on chat. So not to worry, you can continue taking your pills to reduce your pain.
So thank you so much. And I have one question for Puriya, which is very quite offbeat of what we are discussing right now. Is that, I think someone or the other in this room would have someone who had cancer, whether it is breast cancer or any other kind of cancer. How do other people talk to breast or cancer patients? Because some, I think, are completely aloof or some over sympathize. So I don't know, as a person, as a supporter or as family or friend, how do we talk or empathize with a survivor or a patient?
That's a wonderful question. So the reactions I've had, some people, the first reaction was, I had this person in my family who had cancer and that person passed away. And
conversation starter.
And my answer was always, unfortunately, I'm not going to, I'm going to fight it and I'm going to come back. But there have also been, so this is just a very one extreme side, but also there have been people who have been extremely supportive. And, sometimes as cancer patients, you just want people to be there for you. I mean, even if you just send a message saying, hey, checking in on you, how are you doing? You don't even want to know how the treatment is going, how are you feeling? It's okay. Just knowing that you have people who love you and they are there to support you. I think that's important. I feel empathy is good. Sympathy, maybe not. but just being there and just showing that you are there for that person, I think is enough. And maybe not going too much into the details, because kabhi you get so involved or you don't know how to react. I've also had people who did not contact me during the entire course of treatment because they did not know how to react. And that is also okay. I mean, you cannot hold it against them. Maybe sometimes not reacting also is fine than overreacting and maybe making a mess out of the entire situation, I feel. But I think empathy is good, being kind, compassionate, and maybe if just to check if that person needs somebody to, share, because that person goes through so much. So I have been through so much. So sometimes even for me, I just wanted somebody to be there to share my emotions, to share what I felt that time. And I was lucky enough to have people at those points. Sometimes yes, sometimes not. But I mean, just be there for the person.
Puriya, did you seek any counseling or join any support group for this?
Yes, I did. So the moment after the diagnosis, when I mentioned during the PET scan, so that hour was extremely crucial because, you're all alone in the room. Tab tak I was telling them, it feels as if you are talking about somebody who has cancer. But that hour when you're, all alone in the just before the PET scan, you realize it's okay, now it's you, it's happening to you. So first of all, that's when I realized that it's also going to be a mental battle, and physical and mental. So I started therapy, and it actually helped because sometimes you don't really know what's happening, because especially with chemo drugs, the dosage, I think it also has effects. So you don't really know what's happening. You don't really know how to process your thoughts. So I think having that kind of help professionally, it actually helps. So you know how to deal with situations. Because I also remember going through periods of depression, anxiety, panic attacks. So also knowing how to deal with all these things was actually very important. And one part is during the treatment. I think the next part is after the treatment. So you also need a little hand holding after that, because I had a very weird phase after the radiation treatment, the chemotherapy. It's as if it's abhi ho gaya hai, abhi kya karu? Because the body gets so used to the treatment, the pain. Uske baad kya karu main? So also understanding what should be done after that. So because there have been times when I've also suffered from PTSD, which is post-traumatic stress disorder. So how do I even go about, how do I deal with that? So I think that's also important. So maybe when the person is diagnosed, seeking therapy at that time, during and after, I think it's very important to have help during all these three stages. Yeah.
Very important.
Yeah. So my mom has asked, what's the role of physiotherapy? So
That time you had support of that.
So I underwent lumpectomy, and after that I also underwent breast reconstruction surgery. Okay. So lat dorsi muscle was brought ahead. Yeah. So I actually had an issue where I could not move my hand because of the surgery for almost a month. It's basically everything was locked. So basically I had to take physiotherapy to make sure. So I had to relearn how to move my hand, basically. And also I'm an artist, so I needed this hand to paint. So I needed to relearn. And as you mentioned, exercises first of all. And mainly I started physiotherapy at a point where I had just undergone surgery, and just before my chemotherapy sessions. So the physiotherapist had told me that during the chemotherapy sessions, you're going to start becoming weaker and weaker. So now is the time when we start building your strength. So you will be able to sustain, and your body will be ready, basically. So I think that role was important, and it was a very crucial time where I started it, and it really helped.
Dr. Preeti, she spoke about weakness and all that. So in Ayurveda, is there any way where you can build up your strength after you go through this rigorous treatment, aggressive treatment of chemotherapy?
योग, प्राणायाम एंड क्लासिकल म्यूजिक, क्लासिकल इंस्ट्रूमेंट्स कि स्पेसिफिक टाइम पे स्पेसिफिक राग सुनना या स्पेसिफिक इंस्ट्रूमेंट पे स्पेसिफिक राग सुनना, कि मैंने जैसे पहले भी बताया था, विशुद्ध चक्र, अनाहत चक्र, ये दोनों चक्र पे काम करना बहुत जरूरी भी है ब्रेस्ट कैंसर में। और योग और प्राणायाम ये दोनों चीजें भी बहुत जरूरी है, क्योंकि ब्रीदिंग, एक लयबद्ध सांसों के साथ आपकी दिनचर्या होना, ये बहुत जरूरी है। ये सिर्फ ऑक्सीजन में आप रहे हो, लेकिन यू डोंट नो हाउ टू टेक ऑक्सीजन प्रॉपर और मैक्सिमम ऑप्टिमम। तो प्राणायाम, योग और म्यूजिक ये आपको बहुत अच्छा हेल्प दे सकते हैं, सपोर्ट दे सकते हैं। और नो डाउट कि जो आपका मित्र परिवार है वो बहुत जरूरी है, आपका परिवारगण, की उनको पता होना चाहिए कि आप फ्रीज में करेला, पत्ता गोभी, बैंगन ये चीजें नहीं रखनी है, या आपके डाइनिंग टेबल पे गाय का घी ज्यादा रखना है। ये कुछ कुछ चीजें उनको पता होना चाहिए कि हम ऑब्वियसली फ्राइड फूड के लिए तो मना ही करेंगे, लेकिन गाय का घी स्ट्रेंथ और वीकनेस, मतलब स्ट्रेंथ बढ़ाने के लिए, वीकनेस कम करने के लिए बहुत जरूरी होता है।
A very primary question. It is understood that few of the causes which increases the possibility of having breast cancer is lack of breastfeeding, or lack of sexual activity, wearing of synthetic padded bras, and HRT. This is something which is understood. How truthful it is?
So 3 out of the 4 that you said are true. The synthetic padded bra has no evidence based on it. The remaining that you said, which is HRT, I already said. Hormone replacement therapy increases your risk of breast cancer. What were the first two? Come again, sorry. Lack of sexual activity has some evidence that if you're basically sexual activity increases the lymphatic circulation in the breast and obviously is going to reduce. The other thing is, it's a very practical thing. During sexual activity, it is easy to pick up if someone's having when they're regular with their sexual activity, they'll be able to pick it up because the breast will be felt by either partners. So that ways they pick it up early. And the first one was breastfeeding. Yes, if you're feeding, well, your total duration of breastfeeding is less than 2 years, it increases your risk of breast cancer. By 2 years, I mean not every child being fed for 2 years. If someone has 2 children, 1 year each is enough, and that decreases your risk of breast cancer. Anything less than 2 years increases your risk. And I'm not talking about exclusive breastfeeding. I'm talking about any breastfeeding. So if someone's pumping the breast and giving it to the child because he or she's going for work, absolutely okay. But at some time, obviously, the child will suckle again. So that's fine.
What about this lymph drainage? I have been, somebody was telling me about that. So would you be able to throw light on?
So lymph drainage as for post-surgery lymph drainage is what you're asking.
I also heard from someone is that there are these lymph nodes and you need to drain it by, doing that gentle massage. Is that something which you recommend?
So we recommend it post-surgically, definitely. And like she said, physiotherapy plays a major role in it. And in that, we have experts of lymphatic, because we are operating on the axilla, the lymph tends to get deposited in the just under the skin, which is there is a potential of infection in that because it is high. The protein content in that lymph is quite high. So even a small mosquito bite which has been scratched badly can have infection. Hence, in post breast surgery, we always tell our patients to have take care of the hand, not to wear anything which can injure you on that side. Try not to take any BP on that side. Try not to give any blood samples from that side. So basically, what you're trying to do is avoid infection. The other thing that we tell them is that massage towards the neck so that anything that is deposited will also move up. Lymph drainage as prevention of cancer has not been studied and has not been this thing. Yes, there are some very nascent papers which are saying that lymphatic drainage done as a practice would decrease the risk of breast cancer, but I don't know of a RCT which has a randomized control trial which has proven it.
Which I think generates some thermal images instead of mammography is being recommended by some people.
Yeah,
What is
it
your
has
view?
been recommended and they are trying to approach everyone with it. And they had tried to approach us earlier. Tried to approach me earlier when I was in Tata, now here in Nanavati also. So what they are trying to do, the science seems solid. What they're trying to do is they want to pick up temperature differences between cancer and normal breast tissue. And that is going to be picked up by an AI-based app and is going to give you an answer whether there is an increased risk of cancer in that or not. They have yet not been able to produce solid science in the sense of randomized control trials to say that this is as good as a mammography. So unfortunately, it will take some time before they come up with enough data to say that we are as good as any of the imaging modalities. Till date, mammography still remains the standard of care for diagnosing, for investigating while trying to treat, to find out what is the stage of the disease and what is the size of the tumor. Thermography for screening may be an option, but is not as good as a mammography. So if you want to do it, say at your age, if you want to do it if this has been set up in your society, please go ahead and do it. But be aware, if they are calling a thing positive, you will ultimately need to do a mammography to know whether that is positive or not. It may be a wasted exercise. The other sense is also true. When they say it is negative, it might as well be a false negative.
Yeah.
So how screening happens is you have to look for false positives and you have to look for false negatives. And both these should be low. Only then a screening protocol is validated for clinical use or population use in this case. So they don't have enough evidence for that, or hence it has not picked up so well in a lot of centers. I think there are only a couple of centers, and I know the company also that you're talking about. There are only a couple of centers which have put them up as this thing. But like I propagate mammography, I will not say no to a thermography, because whichever way you're doing it, you're at least becoming breast aware. Even if it falsely diagnoses 10 more people, increases the anxiety in them, but they'll eventually get diagnosed properly because they'll go to a doctor.
True.
By not doing anything, at least something is better than nothing here. So be aware. Self-breast examination, clinical breast examination, mammography, thermography, if you want to, there's no harm in it. HIV patient, does HIV increase breast cancer? Is that what you're asking? No. The cancers included with or which are increased because of HIV or its treatment is lymphoma or Kaposi sarcoma. Breast cancer is not included as one of the associated HIV associated breast cancer. Does it change the treatment? No. We regularly operate on HIV positive patients. Doesn't make a difference to this.
I think now that would be the last question. And over to you, Priti.
Thank you so much. Thanks to our panel for such an engaging evening. At BCS, we pride on giving an instant memento So may I request our president, Chirag Doshi, to please hand over this to Dr. Chitkara.
Oh. Can I stand here? It will be better. Thank you. Thank you. Thank you, sir.
President, if you could also hand it over to Puriya, because we already had the chairman giving her the earlier memento.
Thank you. Thank you.
So just 5 minutes, we're going to have a rapid fire round. We wanted to know a little more about you all. Dr. Chitkara, since you have been late, you go first.
Okay.
Okay. Your favorite holiday?
Maldives.
Okay. Favorite movie?
Two of them, actually.
Okay.
I really like Forrest Gump, and I like When Harry Met Sally. Not Sejal, Sally.
Okay. What about favorite snack? Samosa to nahi hoga na?
Fresh हो सकता है.
Look, I love chocolates, but if it is something that I have to really sin on, then vada pav is also good.
घर में बना हुआ होगा, sir. Favorite dialogue or favorite line that you like to use?
So, and it fits every situation. It's from my favorite movie. It's called, it starts with My Mom Says. Tom Hanks is saying this. Life is like a box of chocolates. You never know what you're going to get.
Yeah.
Beautiful. And the last one. If you are not an oncologist or a doctor, you would be?
Chef. I like
Sure.
Vada pav maybe a little. I have more of a non-vegetarian side, chef.
चलिए डॉक्टर प्रीति कुलकर्णी तांबट, आपके सवाल. आपका फेवरेट फेस्टिवल कौन सा है?
रक्षाबंधन.
अरे वाह, क्या बात है. और फेवरेट पास टाइम क्या होगा आपका?
अर्ली मैरिज.
Okay, we'll take this offline. Favorite author?
पढ़ा?
Author जो बुक लिखता है ना आपका, आप किसके बुक्स पढ़ना अच्छा लगता है आपको?
रंजित राय देसाई.
ओके. कॉमेडी या रोमांस या थ्रिलर? मूवीज की बात कर रही हैं?
थ्रिलर.
एंड योर मोस्ट सिग्निफिकेंट अचीवमेंट, मैम?
बीइंग अ महिला आयुर्वेद महिला चिकित्सक.
वाओ, लवली. पुरिया जी, आपके 5 सवाल. फेवरेट क्विजीन?
होममेड फूड घर पे.
किसने बनाया, पति ने या आपने?
I'm happy पति ने बनाया.
Okay.
But I love to cook and I also love to have different types of cuisine. So yeah.
और फेवरेट म्यूजिक कौन सा रहेगा?
I love music, so any genre or any type.
Okay. और फेवरेट पर्सनालिटी, स्पोर्ट्स पर्सनालिटी? आप रनर हो ना, तो अभी कुछ रनर के बारे में सोचिए, या कोई भी और चलेगा.
Weirdly enough, I'm not much into sports.
Okay.
So I've just started running since a year now. So I think it's too soon to answer that.
तो फिल्म पर्सनालिटी ले लो ना, कोई तो पर्सनालिटी होगा कि नहीं?
That's a nice question. Okay.
मैं अपनी फेवरेट हूँ. ऐसे यार मुझे पूछा होता, I would have passed on the questions to you. Okay, mountains, seaside और safaris, क्या पसंद करती हैं आप?
Mountains and seaside.
अच्छा, सब कुछ.
हाँ.
अच्छा.
I think seaside.
Seaside. Okay. And the actor you believe you resemble the most?
This is interesting. So I've had people tell me that I resemble Rani Mukherjee a bit. Not really sure why. Eyes maybe. Yeah, I think Rani Mukherjee.
चलिए, बहुत ही बढ़िया. So thank you so much. May I now invite Gaurav to please propose the vote of thanks.